Would your partner be great except for a thing or two? Maybe there's that bad temper or that little problem with honesty and doing things behind your back. Maybe it's the drinking or drugs or the verbal abuse. Shoot, maybe it's hoarding. Do you live with manipulation, anger outbursts, lying, pathological jealousy, or incessant criticism? You may spend a lot of time thinking about the problems in your relationship and wondering how things can change. And yet there are good times, sometimes. After all, you tell yourself, nobody's perfect, and this is true. You wouldn't be with your partner if there weren't some good times, but it may seem like the longer that you're together, the less often the good times come. I'm psychotherapist Shavaun Scott, and today I'm discussing that common question of how we can get our relationship partners to change. On this channel, I respond to viewer questions about everything related to psychology, relationships, and mental health. If you enjoy this program, please like it and feel free to subscribe to my channel. I use the term dance to describe a consistent pattern of behavior that develops between relationship partners. One person does something predictable and the other reacts in a likewise predictable manner. It's a pattern. Couples dance in sustained patterns of interaction every day, and every couple has their own rhythm. And when people have compatible personalities and values, it often works great. We call that a functional relationship. But people are complicated, and even though relationships start off in the heat of passion, major differences may become apparent as time goes on. In the beginning, our brains produce neurochemicals like dopamine and oxytocin that drive our attachment to a new partner. In the early days of a relationship, we see them through rose-colored glasses, even when there may be things about that person that are not entirely compatible or good for us. I'll cover more on this topic in another video on love addiction. But to put it simply for now, our hormones can trick us into attaching to someone who may not be the best fit for us over time. A couple's dance becomes ugly and dysfunctional when there's a predictable pattern of a problematic behavior by one of the partners, followed by the other's efforts to try to force the partner to change that behavior. Now, in a reasonably healthy relationship, people can negotiate and come up with compromises and solutions most of the time. But when there are repetitive fights and power struggles that escalate, they make people miserable, and the dance increasingly starts to look like a mosh pit, and people can get hurt. The rose-colored glasses are definitely gone. Many people stay in relationships because they think that someday it will get better. Often there's an underlying belief that their partners will change or that something will just happen that makes them behave differently. This is the point where many people come to couples therapy when they're stuck with an ugly, hurtful dance and don't know what to do. Therapists work to help them understand the patterns and see their options for doing things differently. They work to improve communication skills, enhance intimacy and empathy, and hope to find ways for the dance to change. But here's the kicker. Therapists do not have the power to change personality, and sometimes partners are simply incompatible, and one or both of them are not interested in changing. Some people don't have much capacity for change, and this has everything to do with personality. How many times have I seen partners in a power struggle, and each looks at the other saying, "You change," "No, you change," and back and forth they go. No therapist has a magic wand that they can pull out and transform each person into someone that the other would like better. It's simply not possible. I find it important to assess a relationship's potential to ever be functional when I meet with couples. Of course, everyone has a choice about what kind of relationship that they're willing to live with. But here's the main point. You need to be able to accept that the partner you have today is the partner you'll always have. And if that's okay with you, carry on. Can you stay with this partner, accept them as they are, and find ways to live a life of contentment? Can you stop participating in a dysfunctional, painful dance? Now, it depends on how awful the dance is, right? We all need to be conscious of what the deal breakers are for us and run through a series of hard questions. Do you find yourself walking on eggshells, constantly trying to appease your partner so they don't become rageful or abusive? Are you willing to live with lying or substance abuse or a partner who won't hold a job? And are you willing to do this for the rest of your life? Is your partner adding to your happiness and your sense of peace or taking away from it? Are you constantly frustrated and confused about what's going on or looking for evidence of lying? Have you tried talking to your partner about the problems until you're out of breath, making lists of what they need to change and sending long emails, begging them in text to pay attention to how you feel? More than anything, I think you want your partner to have empathy for you. You want to feel loved and respected. In most abusive relationships, we find ourselves believing that we can love our partner into change, and this never works. You say you stay because you love them. But my guess is you don't love who they are. You love the fantasy of who you hope they're going to become someday. You may love a few aspects of the person you're with, but you might be stuck imagining that there'll be a transformation, something that will happen in the future that turns the person you have into the person you really want. Let me make a few guesses about you. I'm going to guess that you're innately kind. You're often an optimist and you see the best in people. You're hopeful, you're patient, you treat people well, so you naturally expect that others will treat you well in return. The thing is, you may be with a partner who doesn't have a great capacity for empathy and compassion. That's a personality trait. And your partner may never care about how you feel. We can all be fooled by our fantasies. Unrealistic hope can cause us to hang on for months, years, even decades to a partner who makes us miserable. And that's a tragedy because we lose the opportunity to experience the best things in life. We give up contentment, and we often resort to our own ineffective coping strategies just to get through the days. There are several thinking errors I see involved with this. And the first is the fantasy of change. It starts with a list of what I call the if-onlys. If only they could manage their anger. If only they had a new job. If only they went to therapy. If only they stopped drinking and using drugs. If only they took their ADD meds. If only, if only, if only. The list goes on forever. Because if your partner hasn't done any of those things after a lengthy period of time, there's a message there. They're likely content with themselves, content to be exactly the way they are. People who want to grow and become healthier work on it. They find resources. They put energy out in the right direction. And remember what I always say, the truth is in the behavior, not the words. If your partner makes promises to change but never follows through with action, there's meaning there. You're likely being manipulated. And in the meantime, your partner is making your life miserable. Let's go over some additional thinking errors. One of these is called the sunk cost fallacy. And this is the term for a common thinking error that we should continue to invest time in something because we've already put time into it, despite the cost to us. You tell yourself that you've invested a lot of time and energy into the relationship, so you can't get out of it now. Some people say this after a year, some after a decade, or even two. Can you imagine yourself in the exact same relationship at age 90 and feel peace about it? Or would you rather create a life of contentment with the time you have left? If you decide to stay, give up the fantasy of change and find ways to be content with the partner that you actually have, because this will be the same partner you have when you're 90. Another belief that I think is an error is the idea that staying together is always honorable. Traditionally, our culture has taught us that there's something inherently terrific about staying in long-term relationships. And I get it. Most of us want to be honorable people. We want to keep our commitments. But this belief has kept many people trapped in hellish relationships. And we can all ask ourselves if that's really something to be venerated. Closely aligned with that is the belief that suffering is noble. Women in particular, if they're from punitive religious backgrounds, have learned that self-sacrifice and giving are noble and that it's selfish for them to have desires of their own. They believe they exist just to help and serve others. The women I've seen in dramatically abusive relationships have all shared this belief to some degree. They believe that they're strong, virtuous, and they can take it. And so they live in a life of misery and don't expect any pleasure. Sometimes they're killed. And we find a lot of pathological coping mechanisms and magical thinking in these situations. When you're living with a pathological partner, there's the risk that you'll slide into your own unhealthy coping mechanisms. This includes relying on alcohol and drugs to numb yourself just to get through the day, or dissociating from reality in various ways, and binge watching hours and hours of TV is in that category. Some people disconnect from the reality of what they're living with and tell themselves someday things will change. But if they never take action to bring change, they're playing tricks on themselves. So what can you do? Stay grounded in reality. You cannot fix your partner. You cannot change your partner. The only life you have any influence on is the one you choose to live. The only brain you can influence is the one inside your head. You can work on your thoughts, your feelings, and your behavior to build a life that brings you contentment and joy. You can learn to notice when your thoughts are veering into fantasy and develop skills with boundary setting to help you stay out of dysfunctional patterns that your partner may try to create. You want to stop the pathological dancing with a pathological person. Now, I'll be dogmatic about one thing. If your partner is violent with you or is abusive with your children, you will need support to get out. There are no compromises with violence or child abuse. If you're struggling with this, please reach out for help to the National Domestic Violence Hotline at 800-799-7233. But what if your partner isn't abusive? They're just difficult. Maybe they have other behaviors or habits that annoy you. If attempts to negotiate and problem solve with them haven't worked, if you meet a brick wall of resistance, you're probably running into innate personality differences that are not likely to change. No couple meshes perfectly, this is true, and conflict is normal. In functional relationships, couples have to come up with compromises, and these are the times that I think couples counseling can really help. But when we get into the area of serious personality pathology, couples counseling generally isn't effective. In fact, sometimes it's counterproductive if it only feeds baseless hope and magical thinking fantasies that a pathological partner is going to change. It's wonderful when a couple dance in sync with each other, creating something that brings joy, enhances their lives, and brings out the best in the other. I think that's the kind of relationship we all want. The loneliest people in the world are those who are with a partner that will never meet their needs, but they're holding on to false hope that someday things will change. Take good care of yourself.